My name is Christopher Bartley. I am a UX designer, and I have a mission. I remember the conversation that I had with Julio, and I was very timid to do this particular type of event because I'm not the subject matter expert in healthcare, but I'm the subject matter expert in solving problems. So for those of you that know what user experience is about, I love to use the example of, anybody been to a Starbucks? Yeah. Anybody opened the door when you should have pulled, you pushed, and you smacked right into it? Okay. That's a user experience problem, you know? And it's because the building might have been symmetrical, it might have looked wonderful, beautiful, the doors were great, but they didn't think about the person who actually had to use it. And so what user experience is about is making something feasible, making something desirable and pleasurable to use, and it actually has to be functional. And, as I think we all know this evening, healthcare, I don't know if it's that quite feasible, you know? But what I learned is that if there is quality, people are willing to forego feasibility if they know that they're getting something that's, we're gonna meet our panelists, and we're just gonna work our way from right to left, you're right, they're right.
Sorry, stage right.
And we have Renee Douthat. She's actually going to be covering EHR and compliance. Then we have Dr. Seth Crapp. He's going to be looking at blockchain and AI. Then we have Scott Burgess, who's going to be talking about hospital infrastructure. And then we have Mr. Asavaid, who is going to be looking at business intelligence. Something that we really don't discuss oftentimes in healthcare, but you're going to see that it actually does make a very big impact when it comes to decision making for healthcare management. So Renee, you can go ahead and start with just sharing what it is that you do, what your role is, and also what you're working on. So this is your time to just, build it.
I should have had that name. So Renee Douthat, background in behavioral health care, home health, physical therapy, in operations, compliance. I've read Joint Commission books. I've probably read 24 different state administrative codes for both, their DCF and their ACAs. So I like to read, apparently. So right now I've created a compliance software for behavioral health. Specifically, we're addressing addiction treatment and doing some really good stuff. So.
Good evening, how's everybody doing? My name is Seth Crapp. I'm a pediatric radiologist, actually. I work at Nicholls Children's Hospital. But aside from that, in the nighttime and after hours, I'm a co-founder of a health technology company called Teledactyl, which is TLEDACTYL. And Teledactyl's aim is to disrupt healthcare in something that we're going to talk about tonight, patient experience and access. So we're trying to improve access for employees from the employer side, and also provide solutions around efficiency and also decreasing costs for employers. We're also trying to improve access to those who are demographically in areas where they lack access. So rural communities, urban areas, even Native Americans and so on and so forth. So that's what that's about. And I'm also a blockchain enthusiast, and I did some training in blockchain at MIT with certification in blockchain business applications. So, thank you.
Good evening. Hi, my name is Scott Burgess. I am an infrastructure expert for hospitals and medical facilities. I have designed some of the most impressive surgical suites in the globe. We started off in university over in Munich, where we built the first intraoperative CT. We then took that knowledge and experience and all those mistakes, and we applied it to the United States. Any questions you may have, we can answer it for you as well. So, thank you.
Good evening. My name is Asavaid, and I'm on the completely other side of the spectrum. I was a little bit surprised when Chris called me, and I said, why not? Let's share my experience. So my experience is really working with very large data sets and creating applications that can help patients, hospitals, pharmaceutical companies, what have you. My job was, when I was working for this company, was to bring all this data together at a patient level so you could see the journey throughout. So that's at a very high level. I cannot think in physical facility times, I think in numbers.